use some hand sanitizer before entering my patient's room. Hi, I'm Abby. I'm going to be your nurse today. Can I get your name and date of birth? Awesome. That matches what I have. Do you have any allergies? No? Perfect. That's what I have as well. Okay, so we have an IV catheter ordered for you. Is that okay if we give you that? Or I place an IV? Awesome. Okay. I want you to be aware of some pain management that we can give you. We have EMLA, which is a med that we can give you 60 minutes prior. We have LMX, which is for 30 minutes prior. We can give you a topical injection of lidocaine, which can help, or we have a spray that I can spray and it'll numb the area. Does any of those sound good, or do you not want anything? You don't want anything? Okay, perfect. Sounds good. I'm just going to grab some supplies that I need for right now. Okay, I'm going to rotate your arm so I can see some good veins. I'm going to apply the tourniquet about 3 to 4 inches above my site. Let's go a little lower. I don't want to tie it tight like that. Just nice and gentle. Okay. This one looks like a good vein, so I think I'm going to use this one. So I would release the tourniquet. Now I would get the rest of my supplies all ready. I would get my saline flush. I would get my Tegaderm all ready. I'm going to set this aside, and this needs to stay sterile, so I'm going to put it right over there so nothing touches it. I have my little cleaner chloroprep. I have my saline lock. I have my catheter, and I think that should be it. I have my gloves. So I'm going to put my gloves on. I'm going to reapply the tourniquet. Make sure that's nice and tight. Okay, so I found my vein again. I would crack this. I'm not going to for the video. Then I'm going to rub side to side and front to back for 30 seconds. Okay, 30 seconds is up. To get my catheter ready. So I need to make sure that this stays sterile the whole time. I'm going to take all the excess bubbles out of it, keep that sterile, and then I'm going to flush that, make sure that no bubbles are in it. Then I'm also going to loosen this cap so that it's easy for me to take off. And this end I also have to keep nice and sterile. So that can just sit right there. Okay. So everything is clean. Now I can get ready for a catheter. I would also place a towel underneath my patient's arm for comfort. Okay, so now I'm going to remove the cap. I'm going to pull the skin, making sure that I don't touch the right area. I'm gonna make sure my bevel is in the right spot. All right, pulling the skin back. I'm going to insert at a 10 to 30 degrees, then level it out. I'm going to wait for a flash of blood. Then I would go another 1 to 1/4 of an inch. I would feed that in. I want to block that so that the blood doesn't come out at me. Keeping this sterile as well, not touching the insertion site or anything. want to take the cap off of this. Keep everything sterile, lock that up. That wouldn't come out. Okay, now I would release the tourniquet. Now I would flush my IV. Before that, I would actually put my Tegaderm on just to stabilize it. I want to have that window all set for me so that I can notice any changes in my IV. So before flushing, I would put this on. Put that over the top there. And then now I would flush, but I'm not going to flush so water doesn't get into the dummy. And I would take the remaining piece of tape, wrap this around, then I would gently place that last piece of tape. Okay, so I flushed it. I noticed that there's no, it's patent. There's no swelling, redness. Are you having any pain right now? No, you feel pretty good? Okay. So I would come back and I would monitor, see how he's doing a few minutes later. But I would be done with that, and then I would chart the site, date and time, the size used, the type of catheter, how much I flushed, patency, anything that is concerning, along with the patient's reaction to the procedure.